Enterococcus genital infection is a less commonly discussed but medically significant bacterial infection that can affect both men and women. While Enterococcus bacteria are normally present in the human gastrointestinal tract and play a role in maintaining gut balance, under certain conditions they can become opportunistic pathogens, invading the urinary and genital systems and causing serious health complications. In recent years, the global medical community has paid increased attention to enterococcus-related infections due to their ability to resist antibiotics, spread in healthcare and community settings, and cause recurrent infections. Despite this, public awareness about Enterococcus genital infections remains extremely low, leading to delayed diagnosis, untreated symptoms, and preventable complications. This video, presented by WUTNews, aims to provide a clear, educational, and stigma-free explanation of Enterococcus genital infection. We will explore its history, causes, transmission routes, symptoms, global distribution, prevention strategies, and protective measures, along with other essential medical information every individual should know. Understanding this infection is not about fear, it is about knowledge, prevention, and responsible health choices. 1. Historical background of Enterococcus infections. The genus Enterococcus was first scientifically identified in the late 19th century. Initially, these bacteria were classified as part of the Streptococcus group. However, in the 1980s, advances in microbiology led to their reclassification into a separate genus due to distinct genetic and biochemical characteristics. For many decades, Enterococcus species were considered harmless commensal organisms. They were known to live peacefully in the intestines of humans and animals. It was only in the mid-20th century that clinicians began to recognize their role in urinary tract infections, wound infections, bloodstream infections, and genital infections. The most common species associated with genital and urinary infections are Enterococcus faecalis, Enterococcus faecalum. As antibiotic use increased worldwide, Enterococcus species adapted rapidly, leading to the emergence of antibiotic-resistant strains, including vancomycin-resistant enterococci, VRE. This development made Enterococcus infections a growing global health concern. 2. What is Enterococcus genital infection? Enterococcus genital infection occurs when Enterococcus bacteria colonize or infect the genital tract, including the urethra, vagina, cervix, prostate, epididymis, or surrounding tissues. Although not classified as a classic sexually transmitted infection, STI, Enterococcus genital infection is often sexually associated, meaning sexual activity can contribute to bacterial transfer or overgrowth. This infection may occur independently, alongside other bacterial infections, after antibiotic use that disrupts normal genital flora. Enterococcus genital infections can be acute or chronic, symptomatic or asymptomatic, and may recur if not treated properly. 3. How Enterococcus genital infection spreads. 3.1. Primary transmission routes. Enterococcus genital infection spreads mainly through indirect mechanisms, including transfer of bacteria from the anal region to the genital area, poor genital hygiene, contaminated hands or objects, medical procedures involving catheters or instruments. 3.2. Role of sexual activity. While Enterococcus is not a traditional STI, certain sexual behaviors can increase the risk: anal to genital contact without proper hygiene, unprotected sexual intercourse, multiple sexual partners, prolonged sexual activity causing microinjuries. Sexual activity can create favorable conditions for bacteria to migrate and colonize the genital tract. 4. Symptoms of Enterococcus genital infection. 4.1. Symptoms in women. Women may experience abnormal vaginal discharge, burning sensation during urination, pelvic discomfort or pain, vaginal itching or irritation, pain during sexual intercourse, recurrent urinary tract infections. In some cases, women may carry the bacteria without noticeable symptoms, increasing the risk of unnoticed spread. 4.2. Symptoms in men. Men may experience urethral burning or discomfort, painful urination, prostate inflammation, testicular or pelvic pain, penile discharge, rare. Chronic infections can contribute to prostatitis and fertility-related issues. 5. Countries and regions where Enterococcus genital infections are reported. Enterococcus genital and urinary infections are reported worldwide, but higher detection rates are observed in the United States, European Union countries, India, China, Brazil, Southeast Asia, Middle Eastern countries. Higher prevalence is often linked to high antibiotic usage, hospital exposure, limited sexual health education, poor sanitation infrastructure. However, underreporting is common due to lack of awareness and misdiagnosis. 6. Diagnosis of Enterococcus genital infection. Accurate diagnosis requires laboratory testing, including urine culture, vaginal or urethral swab, semen analysis in men, antibiotic sensitivity testing. Because Enterococcus species are resistant to many antibiotics, proper identification is crucial for effective treatment. 7. Treatment options. Treatment depends on species type, antibiotic resistance profile, severity of infection. Commonly used antibiotics include ampicillin, nitrofurantone, linezolid for resistant strains. Self-medication is dangerous and can worsen resistance. Always consult a medical professional. 8. How to prevent Enterococcus genital infection. 8.1. Personal hygiene practices. Wash genital areas regularly. Clean from front to back. Wash hands before and after sexual activity. 8.2. Sexual health practices. Use condoms consistently. Avoid anal to genital contact without hygiene. Limit multiple sexual partners. 8.3. Medical precautions. Avoid unnecessary antibiotics. Follow prescribed treatment fully. Get tested if symptoms persist. 9. How to protect yourself long term. Maintain a strong immune system. Eat a balanced diet. Stay hydrated. Get regular health checkups. Educate yourself about sexual health. Prevention is always more effective than treatment. Final message from WUTNews. Sexual and genital health is not a taboo topic. It is a vital part of overall well-being. Understanding infections like Enterococcus genital infection helps protect not only yourself, but also your partners and community. Yes, if you found this information valuable, please subscribe to WUTNews. Bell, turn on notifications to stay informed. Like, and share this video to spread awareness. Comment with your thoughts or questions. WUTNews is committed to delivering accurate, responsible, and life-saving health education.